Well, the White House says that they are looking to make this holiday season the safest holiday season in recent memory.
That's right. And with Thanksgiving just a couple of days away, the Biden administration is once again pushing for Americans to go out and get boosted. The White House is launching a 6-week push aimed at getting updated boosters in the arms of Americans ahead of the holiday season. For the past 2 years, the U.S. has seen spikes in newly confirmed COVID cases following the holidays, of course. But this year, it's not just coronavirus causing concern. There's also the looming threat of the so-called triple-demic in the weeks ahead.
There are two issues that in some respects are unprecedented when it comes to infectious diseases. And that is, as good as the vaccine is, and as good as post-infection protection is, the immunity and protection wanes over time. Let me put it into some perspective for you. If you get vaccinated with measles or infected with measles, the duration of protection is measured at a minimum in decades and likely for a lifetime. That just happens to, unfortunately, not be the case when you're dealing with coronavirus and particularly SARS-CoV-2. So you need to update the protection.
Let's bring in CBS News medical contributor, Dr. Celin Gounder, now for more on this. Dr. Gounder, always so good to have you, especially when you're here on set. So we just heard Dr. Anthony Fauci saying that we have to update our vaccine, our COVID vaccines, in order for them to remain effective. Do you think that the Biden administration's plans to push for the 6 weeks to get Americans either vaccinated for the first time, because we know that that's still a problem, or boosted, is going to be successful, also given that it takes a bit of time before we really see those vaccines kick into high gear, and Thanksgiving is just days away now?
COVID hasn't surged yet, so we do have time to get vaccines into people. And what we're seeing now at this stage in the pandemic is who is at greatest risk for hospitalization and death. It's people who are ages 65 and over. So 90% of the COVID deaths are now occurring in that group, and people who are not vaccinated. So even if they've had a previous infection, that is not adequate to protect them against hospitalization and death. So this new push is really going to focus on some of these highest risk groups, the elderly. So, for example, elderly community centers, disabled populations, nursing homes. And that's really where you're going to get the biggest bang for your buck in pushing for vaccination.
Now, we know that Thanksgiving being 2 days away, this year, COVID spikes. But this year, there's also concerns over RSV and the flu. How concerned are you about this so-called triple-demic that, we keep hearing about?
I am concerned. Hospitals are really full. Hospital beds are full. Emergency departments are full. I've been hearing horror stories about young children who have RSV or the flu who are requiring ICU, intensive care unit care, with ventilators, where the doctors are having to call hospitals all over the East Coast, Northeast, to find a hospital bed for that child. And if you're a parent and you're sitting there watching these doctors scrambling to try to get that bed for you, for your child, it's a really scary situation. So
it's a good time to get the flu as well, keep the flu shot as well, keep the hospitals light, and of course get the boosters.
Absolutely. And I think another thing that's been underappreciated is the ongoing role for masks. And that was something that was discussed in the White House press briefing with Drs. Fauci and Jha earlier today, this question of why is it we're not really talking enough about masks? And I think, unfortunately, this is the ongoing politicization of masks. They do, in fact, work. They work in children. They work in adults. And they really do have a role still for reducing the risk of transmission.
But let me follow up on that, because there are some people who feel like maybe it's because the kids have been so masked up that they're getting these really big reactions to the flu, to RSV, and those sorts of things. How do you balance that? And what do you say to people who are concerned about masking actually keeping our kids from boosting their own immunoresponses?
Well, we have a flu shot. So the flu shot, that's the whole point of the flu shot, is to boost your immune response and to do so in a safer way than getting the infection itself. That's actually the theory behind all of our vaccines, is to give you that immunity without the risk of the infection itself. RSV is a more difficult one. We don't have a vaccine for it yet. There are, in fact, several vaccine candidates for RSV in the works, and I do anticipate in the next couple of years we will have one. But at least for now, our best protection is masking and staying away from others when they're sick.
All right. Dr. Celin Gounder, thanks for being here. Thank you for all that you do.